symptoms go away. Some are very mild. Now, for some of those people, then something comes back. Then, even though they didn't have bad things in the beginning, they start to develop things later on. Maybe related, maybe not. Then you have another group. And I've been reluctant to discuss this with you guys because enough about me and the COVID. So many people have it. But I am in this other group, okay? And you're going to meet my friend Shelby Hedgecock, who is in my group as well, where we got sick and it's not really going away. This is more true for Shelby than it is for me. Again, I am one of the lucky ones, and I ain't that lucky, okay? For me, it's depression. My body isn't recovering the way it did. I'm having problems with my blood levels. Now, I do have a lot of antibodies, and Sanjay Gupta and I are going to show you how to donate plasma if you have them, and I'm fit as a fiddle for that purpose. But my head's not right, my body's not right, my lungs aren't right. Shelby was tested several times, then came back positive in April, negative a couple of times in May, positive again at the end of May. Why? Look, testing is not 100%, and there's something called viral load. You know, even though you may feel one way, you may have a certain amount of virus in the system, it can trigger the testing. As we approach September, Shelby continues to live with everything from loss of smell to lack of feeling in her legs. She joins me tonight along with Dr. William Lee, okay? Now, I met William Lee through another friend who's dealing with long haul, and he has been studying people like Shelby and me to figure out what's going on, and he sees something that's not being discussed. First, Shelby, good to see you. Thank you so much for reaching out and keeping me in the loop with stuff that is not exactly comfortable to talk about. But what do you want people to know about your experience?
Thank you for having me again, Chris, and I hate that you're still dealing with it as well. I mean, I'm going on month 5, and I'm still dealing with neurological issues, cognitive issues. I was back in the hospital about 3 weeks ago, and I had to wear a heart monitor for 2 weeks because my pulse skyrocketed to about 150 beats per minute. It stayed that way for about 45 minutes, and I've been having weird shortness of breath since then, chest pain. And guys, I mean, people are having real serious issues, very, very serious issues. I mean, I was a personal trainer before this, and I can't even do gentle yoga without being in bed with horrible body aches and pains for days after, and it's debilitating. We're seeing very severe issues. I mean, every organ system is affected, and it's very, very scary.
So, Shelby,
So
Dr. Lee is listening. You can't see him. You can't see Dr. Lee, but he's listening to you, and he's nodding his head. Yes, yes, because in talking with him, you know, I guess we take, you know, the word commiserate. People, you know, misery loves company. It is good to know that you're not alone, but it's sad for everybody who's dealing with it, of course. Now, Dr. Lee, when I spoke to you and I was telling you the kinds of symptoms I was hearing about, you said yes. And part of the reason that the scientific community is surprised, as you have deduced to this point, is that it was seen as just a lung virus. But now you see it as something else that is starting to make more sense to you in terms of what you're hearing from people like Shelby. Explain.
Well, when the pandemic hit and we started to take a notice of the lung aspects of the coronavirus, everybody was focused just on the breathing. But one of the things we started to notice that was really curious is the COVID toe, the brain syndrome, the strokes, the heart attack-like syndromes that turned out not to be a heart attack. And so one of the things that now needs to be discussed, because we're seeing it far beyond the acute COVID syndrome, is the long-term syndromes that are surfacing everywhere. And this is the conversation that needs to be had in the medical and the research community, and not just in the sufferers who are actually dealing with it. And one of the things that we did in my group is we started to take a deep dive to find out what was happening that could connect all these apparently unconnected symptoms and syndromes. And it turns out it may be blood vessels that the coronavirus is infecting, which then, of course, connect to everywhere in the body.
So what does a Shelby do? about this? Because everybody who goes to the doctor is told time.
Well, this is clearly not, sort of the average post-viral syndrome, and there's a lot we don't understand about it. So, I think what's really humbling to those of us in medical research and in clinical care is when we confront something we just don't know enough about. But we need to take it seriously, and we need to have the humility to recognize that we're just starting to observe and collect the data right now. Now, what I'm trying to do is to connect the dots, because we've actually seen the virus infecting the lining of the blood vessels, the endothelial cells, then cells getting inflamed, and then actually carrying that into blood clots that can rage across the body from the lungs to the heart and elsewhere. So we think that this long-term damage may in part be due to vascular damage. It's kind of a footprint that the virus leaves, even when it's gone from the body. Now, what's interesting about the heart is that just a couple of weeks ago, there were 2 studies out of Frankfurt, Germany, one of which looked at 100 patients with COVID recovered, including people that weren't even in a hospital. And they all had chest pain, and they actually had cardiac imaging done to look at their heart, because these patients had fluttering, as you said, Shelby. And what they found was really amazing. 78% actually had some evidence of long-term heart impact. So that would be a depressed pumping ability. It could be fluid around the heart. And so one of the things we started to realize is that this is real, and we can't write it off. And even in the brain, we're beginning to sort of conceptualize that the blood vessels may also play a role there.
Well, look, Shelby's listening to you, and she's like, yeah, great. Listen, It could be, Shelby, it could be. And a lot of this is attitude right now. Shelby was teasing with me. She was like, don't give me short shrift on this segment. I had my hair done for you. At least we can have you've seen the pictures of people sending you all their hair, right, Shelby, from all this hair loss, especially women. And look, God forbid, the worst thing that happens to you is that you lose some hair and it comes back. You got lucky. But, you've noticed there's a whole community out there, Shelby, right?
Right. And I'm a part of a couple different groups. I mean, we have the long haul COVID fighters, we have Survivor Corps. And with Survivor Corps, I mean, we're really doing a lot of research. We're actually conducting a survey right now that is actually looking into the longevity of symptoms. And I mean, we're just now seeing some of the numbers come in, and it's terrifying. And as you were saying, I mean, this is a conversation that just is not happening. And if we look at 1 in 3 people that are having these long-term complications, I mean, 6 million people have coronavirus in the United States. That's 2 million people. That doesn't even account for the people that didn't get a positive COVID test. So this is going to be a public health debacle that's going to last for decades to come, and it needs to be a conversation that keeps on happening. So we just need to keep talking about it, and I greatly appreciate your time today, Doctor. Bringing that up, that definitely gives us some insight. I know a lot of long haulers are watching, so.
Right, and unfortunately, there are too many of them. And look, of course, for the long haulers, they have the best thing in me you can ask for with the media, which is joint purpose. Sometimes we cover things too much, and then we move away and we don't care anymore. Or not that we don't care, but the audience gets compassion fatigue and we move on. I can't have that happen, Dr. Lee, because I support the work that you're doing. I know it's going to lead somewhere good for people, and it's going to be on the back of people like Shelby Hedgecock, who's being honest with you and talking about what's going on and living it in real time, because I just know I'm one of the lucky ones, and I am nowhere near where I was before I had this. I'm lucky I'm here. But, Doctor,
Chris,
go ahead. Last word to you.
Yeah. This is one of the things that I think that having this conversation tonight is the beginning of actually being able to solve this crisis. And you're somebody who has such reserve and capacity to be able to communicate. I think one of the things that you need to be able to do is to be absolutely candid with your audience and listeners, and to encourage people not to hold back, but to really put it out there, and so that everybody will start to listen. I mean, this is really how it starts to solve problems.
I agree with you. This is tricky. And Shelby has said the same thing, but I have to tell you, this is what I've learned. Turns out that when you say that you have brain fog and depression that doesn't go away, it doesn't exactly excite your audience. And a lot of people